Continuing with our class on metformin. In the previous session, we have discussed about the mechanism of action of metformin. That is through AMP kinase activation. Today, we are going to see the side effects and the uses of metformin. So metformin, one thing we need to remember is the clearance of metformin approximates the GFR. So therefore, whenever there is a renal failure, it gets accumulated and it leads to increased risk of lactic acidosis, which is the major side effect of metformin. तो मेटफॉर्मिन का सबसे कॉमन साइड इफेक्ट क्या होता है? जीआई. तो मेजर कॉमन साइड इफेक्ट इज जीआई साइड इफेक्ट लाइक एब्डोमिनल पेन, ब्लोटिंग सेंसेशन, nausea, metallic taste and diarrhea. These are the major GI intolerance it causes. Then very important thing is that it does not cause hypoglycemia except overdose में, but otherwise it does not cause hypoglycemia. And a very major side effect we need to remember is lactic acidosis. Lactic acidosis, though it is rare, but the risk is higher in liver and renal failure. Okay, so that is why it is also it is contraindicated in liver and renal diseases and also in chronic alcoholic patient. Okay, because there is increased risk of lactic acidosis. Now, why there is lactic acidosis? Metformin reduces the blood glucose level. How? It stimulates the glycolysis and inhibits the gluconeogenesis. तो stimulate करेगा अगर glycolysis को, तो glucose will be converted into lactic acid. Now, lactic acid eventually converts into glucose by gluconeogenesis, but metformin inhibits the gluconeogenesis. So lactic acid keeps on accumulating. So stimulation of glycolysis, inhibition of gluconeogenesis leads to accumulation of lactic acidosis, which is the risk is more in liver and renal failure or in chronic alcoholic patient. Okay. Now, the another side effect is vitamin B12 deficiency leading to megaloblastic anemia. Why? Because you have already read in the mechanism of action that it interferes with the B12 absorption. Now, the contraindications are hypotensive states, heart failure, severe respiratory, hepatic and renal diseases, and alcoholism. In all of these situations, there is increased risk of lactic acidosis. So major contraindication is because of lactic acidosis, and the major contraindication is liver and renal failure. Okay, and their interactions with drugs like cimetidine and furosemide, they competes with the metformin excretion and they increases the toxicity of metformin. Now, coming to the uses, first we need to know about a very famous trial, UKPDS 10-year trial. In this 10-year trial, it has been shown that only metformin, none another drug, no other drug, only metformin, independent of its glucose lowering effect. Not because of its glucose lowering effect, it is independent action. It significantly reduces the diabetes related deaths, the myocardial infarction, any diabetes related endpoint, any endpoint because of diabetes has been reduced, and all cause of mortality, diabetes related death or all cause of mortality in a diabetes patient has been reduced. This has been shown in this trial. Now, coming to the guidelines, the therapeutic status as per American Diabetes Association and European. So American and European guideline, both of these guidelines, what does this say? They recommend the use of metformin plus diet plus exercise as the first line treatment, the initial pharmacological intervention in type 2 diabetes mellitus. Both the American and European guidelines. नाउ एडवांटेज क्या मेटफॉर्मिन यूज करने का? हाइपोग्लाइसीमिया नहीं होता है, वेट लॉस भी प्रमोट होता है, इट प्रिवेंट्स बोथ द माइक्रोवेस्कुलर एज वेल एज मैक्रोवेस्कुलर कॉम्प्लिकेशन ऑफ डायबिटीज मेलाइटिस. बीटा सेल फेलियर का कोई एक्सेलरेशन नहीं होता है इन टाइप 2 डायबिटीज मेलाइटिस. ओके, इट प्रमोट्स द हेल्थ. HbA1c रिडक्शन इज 0.8 to 1.2%. इट कैन बी कंबाइंड विद एनी अदर ड्रग. द ओनली लिमिटिंग फैक्टर इज द GI intolerance that develops at the high doses. Now, there are other pleiotropic effects of the metformin, okay, which we have discussed in the previous classes, and that is why it has many off-label uses, like in pre-diabetes, obesity, gestational diabetes, PCOS, NAFLD, antipsychotic-induced weight gain. Then possible is in anti-aging, anti-cancer, neuroprotection. Okay,